This is a review from class, Chapter 9 from the Claywell book. And talking about from novice to expert. In general, a novice is rule-driven and is a concrete thinker and believes and trusts whomever has authority or whatever direction is perceived to have come from someone in authority. Novice nurses may ask the help of another more experienced nurse. The novice nurse makes their learning needs known, is prepared to take new learning experiences, and is thoughtful about the learning that is taking place. They are confident enough to ask questions, seek clarification, and seek constructive input. They understand the experience needed to gain expertise and are open to dialogue with the mentor. The novice nurse is clear, precise, and thoughtful in the questions asked and in the dialogue that follows. They're hungry for learning. They're looking for experiences, and they demonstrate this through a sound plan and focused on the matters at hand. They are beginners that have beginning skills. They lack experience, and this is why they do what they're told. An advanced beginner gains experience in the field and demonstrates a solid performance. The advanced beginner can be a new graduate nurse with marginally acceptable performance and relies on other experienced nurses. This is a level that some graduates begin in. A competent nurse is able to multitask, set goals, and think analytically. Usually they're in the role 2 to 3 years. They'll develop safe organizational skills to get through the day's task efficiently. Flexibility within the nursing role is difficult to manage at this point, and when deviations from the schedule occur, the nurse generally has feelings of unease. Competent nurses have developed skills and are routine-driven, often struggling with the flexibility. Proficient. A proficient nurse is experienced and has a beginning ability to recognize patterns and think critically. The proficient nurse sees the whole and focuses on long-term goals and the level of expert nurse is reached after considerable experience, because then they recognize patterns and have responses that are automatic and integrated. The proficient nurse thinks critically about situation and anticipates the needs of the patients. They have much experience, and they have a beginning ability to recognize patterns and think both holistically and critically. The expert nurse are skilled critical thinkers and handle challenges much easier. An expert nurse has a great deal of experience and is flexible, adaptable, responds to change, and according to Benner, the expert nurse is a skilled critical thinker who has gained experience and skills through practice. CUSN, Quality and Safety Education for Nurses, addresses the challenge of preparing future nurses with the knowledge, skills, and attitudes necessary to continuously improve the quality and safety of the healthcare systems within which they work. Accountability is being answerable for the actions or interventions one performs as a nurse. It also means taking responsibility for one's other actions and growth. Although individuals are ultimately accountable to themselves, the RN is particularly accountable to the patient, society, and to the profession. In a root cause analysis, a committee could be formed which could include a facilitator, which is usually the risk manager or performance improvement director, the nurse or nurses involved, a pharmacist, the physician, and a team leader or supervisor. The purpose of the committee is to reconstruct the events that led up to an error. By looking at the process, the committee may discover that a physician's order was unclear, that 2 drugs with similar names were placed next to each other in the medication dispensing unit, or that the unit of measure for the drug was unclear. Nurses are responsible for reporting changes in patients' conditions right away, and a lack of timely and appropriate response is failure to prevent a clinically important deterioration that will lead to death or permanent disability. It is critical to monitor patients carefully to identify deteriorations and intervene appropriately. The Agency for Healthcare Research and Quality uses a system of quality indicators to determine the standards of quality healthcare and if a particular provider is meeting those standards. These indicators are divided into 4 subcategories. Prevention Quality Indicator, which is used to identify hospital admissions that could have been avoided through higher quality outpatient care. This is used primarily concerning patients who experience return visits. An Inpatient Quality Indicator is concerning the quality of patient care inside a hospital. These numbers would reflect patient mortality rates in a given hospital caused by the lack of care or surgical procedures. The third one is patient safety indicators, and these concerns are the quality of care that patients in the hospital, specifically the mortalities related to avoidable complications, such as those caused by outdated hospital machinery. Pediatric quality indicators are concerned with some of the same aspects that we just talked about, but it's more concerning the pediatric population. Hospital performance results based on these quality indicators are reported in an annual survey. Unfortunately, this organization lacks the authority to penalize organizations that receive low marks for quality indicators. The Agency for Healthcare Research and Quality is a culture of safety or a commitment on both individual and organizational levels to accept accountability to attain excellence in performance by directing resources toward the problems. The National Quality Forum has a three-part mission: to set goals for performance improvement, to endorse standards for measuring and reporting on performance, and to promote educational and outreach programs. If a colleague has made an error and if it was not reported, then the nurse not reporting would also be held accountable. This is why nurses must act judiciously and prudently in the delivery of care. By not going to a supervisor when a mistake is made and failing to demonstrate accountability for contributing to the mistake, the nurse risks not only harm to the patient, but also potential legal and ethical consequences. The nurse manager then would have the responsibility to meet with the nurse involved in the error and create a plan to help ensure that the error does not happen again. This can be done by setting up a time in which to educate the nurse about the 6 rights of medication administration. The supervisor should not ignore the error, ask someone else to handle it, or use an incident report in a punitive manner. Never events are events that should never occur in healthcare, including wrong site injuries, patient suicides, and the unintended retention of a foreign object in a patient after surgery. Because never events are devastating and preventable, healthcare organizations are under increasing pressure to eliminate them completely. The Centers for Medicare and Medicaid Services announced in August of 2007 that Medicare would no longer pay for additional costs associated with preventable errors, especially those considered never events.